Alright, this is my audience. The process of healthcare reform in the United States began with the President Barack Obama administration. The Affordable Care Act, also known as ACA, officially called the Patient Protection and Affordable Care Act, and sometimes referred to as Obamacare, is a U.S. law that reforms both the healthcare and health insurance industries in America. The reform was backed by President Barack Obama since 2009 and is the reason the reform has been termed Obamacare by some. With passage by the House of Representatives on December 24, 2009, and later passed by the Senate on March 21, 2010, with the signing by President Obama on March 23, 2010. This healthcare reform law was placed into law. The priority of the new healthcare reform was to increase the quality, availability, and affordability of private and public health insurance to over 44 million uninsured Americans through its many provisions, which include new regulations, taxes, mandates, and subsidies. The Affordable Care Act has resulted in several aspects, both pros and cons, that will be discussed throughout the remainder of the document. It was the belief of the President and members of the Congress that the health care was more of a right than a privilege. The belief was that every American, regardless of their current health or financial circumstances, would have health insurance even if their situation meant that they could not afford to pay the health insurance premiums the government lent assistance to them. The law also said that those who chose to not participate in the health insurance program would suffer tax penalties. The law did allow for those who had already had health insurance, which was put into place before 2010, to be grandfathered into plan. However, any plans after the 2010 were subject to meet the new criteria of the ACA plans. Larger employers were mandated to provide health insurance to their workers. It was no longer an option of the company. Small companies were to receive subsidies that would help and make providing health insurance for their workers more affordable in the company. The many are beliefs of the healthcare reform as it pertains to those individuals who did not have healthcare insurance prior to the new law, either because it was not available to them, was not affordable, or did not qualify for coverage due to health reasons. The law provides that all people be required to have insurance and would provide for the premium cost assistance for those that qualify for assistance in the marketplace. It was also provided that large employers must supply health insurance to their employees and small employers gain eligibility for subsidies health insurance premiums for their workers. Perhaps one of the most important aspects of law is that no person can be denied coverage due to previous medical conditions, as it was prior to the passage of the law. The law would provide for insurance for all people with no discrimination for premiums based on medical condition, age, or gender. Also, a person could not be denied medical coverage based on gender, age, or race, or condition that one is suffering from. The ACA allows children the ability to stay on their parents' health care plan until age 26. There are no disqualifications for this rule. A child can be married and remain on their parents' insurance plan even if they don't live in their parents' house. They are allowed to give birth or adopt a child and still remain on their parents' policy. Lastly, those who have received help in paying their premiums may receive a shock in they are accustomed to receiving a tax refund. Any help or credit they may receive in the marketplace is recoverable by the government in keeping any pending refund up to the amount of help or assistance received as part of the premium decrease. This means if they had ordinarily received a $2,500 refund, for example, on their income tax return, which they would have used to pay bills the following year. And they also received premium assistance on their health insurance premium that amounted to $3,000 over the year. The result would be that the government would retain their tax refund as repayment toward the premium decrease. Also, 12 of the 23 consumer-operated and oriented plans in the U.S., which were intended to spur competition and lower prices, folded in 2015, costing American taxpayers more than $1.23 billion.